UNAIDS Executive Director Winnie Byanyima says high levels of inequality within and between countries is making the world more vulnerable to pandemics. She spoke at the launch of the Global Council on Inequality AIDS and Pandemics in Johannesburg. This comes as South Africa gears up to host the G20 summit later this month. Let's get the latest now from our reporter Khayelihle Khumalo. Kaya, over to you.
Certainly a very comprehensive report here in Johannesburg, really just painting a very bleak picture about the inequalities and how really they are affecting this journey of combating and fighting pandemics. And we saw those awful lessons from COVID-19 and many other pandemics. But really to delve into some of the key highlights of the reports, we're joined by the Executive Director of UNAIDS, Ms. Byanyima. So once again, thank you so much for your time. So it's very clear that the world must act. Looking at this relationship, a very terrible relationship between inequalities and also the pandemics and how they're prolonging these pandemics that we see.
Yes, on the margins of the G20 meetings, this report by the Global Council shows very clearly that there is a vicious cycle linkage between inequality and pandemics, but that also we can break that cycle. The cycle where inequalities take an outbreak, make it a pandemic, prolong it, make it deadly, economically devastating, making more inequality in the society that drives more pandemics. To break it, there are certain things that need to happen. We are here to tell the G20 what those things are and what they can do about them. In the global economy, we need to have the issue of equitable access to finance addressed. For a continent like Africa to still be having the highest number of deaths and new infections of HIV, facing COVID, Mpox, Ebola, but not have the resources to invest in health is largely because it's trapped in debt. The debt should be suspended, a pause up to 2030 so the countries can restructure it and have space for health and education and other priorities. We need to have a standby facility. So when the next pandemic hits, countries like developing countries can go and get access to resources immediately to address a pandemic. Secondly, we need to have solutions to access to new technologies. We saw it during COVID. New technologies came, COVID vaccines, but Africa was standing at the back of the queue and people died where they could have been saved. We have solutions in this report for moving away from monopolistic system where innovation is monopolized and profits are maximized at the cost of lives to one where you use prizes. You reward innovation differently and you make new technologies global public goods, especially in pandemics. Do you know that in COVID, new billionaires, 573 people became billionaires in 2 years, and while at the same time 167 million people sank into poverty and millions died who could have been saved from COVID just because a few companies could hoard, keep their technology, hoard production, and that was the result. So we have recommendations about addressing access to medicines, access to finance, supporting local and regional production of medicines. Brazil is leading a global alliance for the production, for regional production of medicines. This was launched last year announced last year and launched this year by Brazil. We are here to ask the member states, 20 richest countries in the world, to embrace this, to ask the international financial institutions to put money down to support strengthening regional production of medicines, especially here in Africa. We also have something to say about national policies. You have to have a system of health that addresses health inequalities, universal health coverage. So we are here also to point to countries such as yours, South Africa, trying its best to reform the health system so that there is no longer a system for the rich and a poor and poorly financed system for the majority. A national health insurance system that guarantees that everyone has access that is what can protect people from pandemics. We are also here to support other national policies that reduce inequalities and prepare countries to be resilient, such as labor rights, having laws that guarantee fair wages, such as publicly provided education. All these we have shown can contribute to resilience to pandemics.
And just before I let you go, ma'am, expectations are high for South Africa. G20 is coming, especially amid a very harsh global environment. And obviously we know that health is a key priority in this regard.
For South Africa is the most unequal country in the world, but South Africa is also the fiercest fighter against inequality. And it's no surprise that the theme for G20, led by South Africa, is solidarity, meaning all countries of the world coming together to solve global problems, equality, challenging those inequalities that make people vulnerable, and thirdly, sustainability, working together to save our planet. We are here from the health side to support South Africa's proposals here at the health ministers' meetings, supporting universal health coverage, supporting social protection measures, supporting regional production of medicines for the world. That is why we're here, to support the agenda that South Africa has put down for the G20 about challenging inequalities.
All right, ma'am, thank you so much indeed. And of course, we do know that you will have an opportunity as well to meet with South Africa's President Cyril Ramaphosa, but essentially quite a very important report being launched in South Africa in Johannesburg. So with that, back to you in studio.
Right, thank you so much, Khayelihle Khumalo, there for us. Of course, this is as he's at the report launch there, UNAIDS Executive Director Winnie Byanyima speaking there about that damning report, just showing the levels of inequality within and between countries. All right, Mawande is standing by with your sports.